Brought to you by Dr. Joe Audia. Frequently asked questions about neurosurgery and pain management. Questions 91 to 95. The brain and eyes working together. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 91. The primary care doctor usually uses a stethoscope to listen to the heart, but the neurologist and neurosurgeon examine the eyes using an ophthalmoscope. Why do they look into the eyes to learn about the brain?
Answer. Humans possess 5 primary senses, which collect information through sensory organs and transmit it to the brain, where it is processed and interpreted, allowing us to perceive and interact with our environment. They are sight, hearing, touch, taste, and smell. The eyes are the sensory organs for sight. They perceive light, which the retina, often referred to as the window to the brain, converts into electrical energy. The optic nerves, identified as the second cranial nerves, extend from the retina of the eyes to relay centers in the thalamus and terminate in the visual cortex of the brain. The information is compared with stored memories to enable the recognition of faces, shapes, and locations. Additionally, eye movements are controlled by the brain. If a newborn has poor vision in one eye, it can go on to become what is commonly known as a lazy eye. A thorough eye evaluation should be included in the routine examination of all newborns and children. We often associate cataracts with adults, but globally, congenital cataracts rank among the leading causes of blindness in children, and they are often attributed to genetic factors. The eyes can provide information about certain neurological conditions. The optic disc is where the optic nerve enters the eye. Examination with an ophthalmoscope might demonstrate inflammation of the optic disc, known as optic neuritis, which may be the first sign of multiple sclerosis. Swelling of the optic disc, referred to as papilledema, is a clinical sign of raised intracranial pressure and may occur in such conditions as a brain tumor or head injury. The center of the retina is called the macula, and it converts light into the sharpest and clearest images. In macular degeneration, examination of the retina often reveals abnormal deposits and other pathological changes.
Question number 92. What exactly is a lazy eye?
Answer. A lazy eye, which is also called amblyopia, is reduction in vision in one eye, less often both eyes, caused by an eye abnormality in early childhood, usually from birth to age of 7, but it can occur up to the age of 60 years. It is one of the leading causes of visual impairment in children. The disorder leads to poor development of the visual cortex of the occipital lobe on the opposite side of the brain. The most common cause is called strabismus, commonly referred to as crossed eyes, and is due to an imbalance in the muscles that control eye movements, resulting in misalignment of the eyes. When one eye focuses in one direction, the lazy eye deviates to a different direction. Over time, the brain begins to ignore information from the lazy eye, leading to loss of acuity. Conditions like congenital cataracts and droopy eyelid, which obstruct vision, may hinder the proper formation of eye-brain connections, increasing the risk of developing a lazy eye. Ideally, early detection by age 7 and effective treatment will increase the chance of a successful outcome. The type of treatment depends on the underlying etiology and can include the use of eyeglasses or contact lenses to correct the blurriness from refractive differences. Intermittent patching or atropine drops applied to blur vision in the stronger eye can force the brain to respond to the weaker eye. Vision exercises can be used to strengthen the affected eye. Some patients with strabismus or cataracts require early surgery to avert irreversible blindness caused by disrupted development of the visual cortex of the brain. Double vision and difficulty with depth perception are also common symptoms of strabismus. The two eyes work as a team. A minor league baseball player who often strikes out or misjudges fly balls may be experiencing issues with depth perception. Depth perception is the visual ability to perceive the world in 3 dimensions, length, width, and depth, and to accurately determine the distance of objects. Poor depth perception can make it difficult to follow the ball's path or accurately judge the height and speed. Promptly addressing the root cause could very well pave the way for the next Red Sox legend to emerge. That said, I have a genuine respect for the Yankees.
Question number 93. You said that the light that is perceived by the eyes is processed in the brain, where it is interpreted as faces, shapes and locations. Can you explain the process?
Answer. Visual recognition refers to the ability to identify and interpret visual stimuli, including the identification of faces, objects, and places. Several stages are involved in the process. The eyes receive the visual input, which is converted to electrical energy in the retina, travels through the optic nerves, synapsing in the thalamus, before reaching the occipital lobe, where it is processed. The input is compared with memories stored in the brain to identify similarities that facilitate the recognition of faces or other objects. This process enables us to recognize familiar faces. Artificial intelligence uses a similar principle for facial recognition technology, taking advantage of computer neural networks, a vast memory bank, and super-fast data transmission. Visual memory is often impaired in brain disorders such as dementia and Alzheimer's disease, making it difficult to recognize faces and loved ones. Amnesia, meaning memory loss, is a common feature of traumatic brain injury with concussion, and is due to disruption of brain function, including visual processing. A number of developmental disorders can also impact visual processing and result in problems with reading, understanding written material, and facial recognition. The disorders include autism spectrum disorder, ADHD, or attention deficit hyperactivity disorder, and Down syndrome. A noteworthy condition deserves some mention here. REM, rapid eye movement sleep, is a natural phase of the sleep cycle characterized by quick eye movements known as saccades occurring under closed eyelids, while the rest of the body remains largely still. These eye movements are driven by heightened brain activity. Most vivid dreams take place during REM sleep. Disruptions in REM sleep may be early indicators of neurodegenerative diseases such as dementia, Alzheimer's, multiple sclerosis, and Parkinson's disease. In REM sleep behavior disorder, RBD, individuals physically act out their dreams because muscle activity is no longer suppressed during REM sleep. The response can include kicking, punching, or shouting. Most people are able to recall these episodes when they wake up.
Question number 94. What information can be gained from the pupils in pain management?
Answer. We know that pain is perceived in the brain and that the eyes are directly connected to the brain. The 3 primary features of the pupils that are of clinical interest are size, symmetry, and reaction to light, and their measurement is known as pupillometry. All 3 elements can be affected by the level of pain, response of the autonomic nervous system, and the effect of medication. Severe acute pain activates the sympathetic nervous system to produce fight or flight hormones, resulting in dilatation of the pupils to optimize visual awareness. This can be a very useful sign in a nonverbal patient, especially if it is accompanied by increased pulse rate and high blood pressure. I wish to emphasize that this response applies to acute but not chronic pain. Pain is a subjective experience, and there is presently no objective way to measure the intensity. Constriction of the pupil may be a sign of stimulation of the parasympathetic system from opioid overdose, resulting in pinpoint pupils. When accompanied by respiratory depression and drowsiness, the administration of naloxone, an opioid antagonist, should be considered depending on the clinical circumstances. The effect is temporary. Therefore, if administered outside a medical facility or first responders, it is essential to call 911 immediately for further assistance.
Question number 95. In what ways do you believe that the integration of artificial intelligence into eye examinations could enhance medical diagnosis in the future?
Answer. AI-powered imaging of the eye is rapidly emerging as a valuable diagnostic technology not only for eye disorders, but for some neurological and systemic conditions as well. I see it as playing an important role in the diagnosis of disorders like diabetic retinopathy, glaucoma, and macular degeneration. Recent studies suggest that changes in the eyes associated with dementia and Alzheimer's disease may be detectable up to 7 to 12 years prior to the onset of symptoms. AI is increasingly effective in detecting subtle changes in the blood vessels, nerve layers, and cellular structure of the retina, which can be early indicators of conditions such as stroke, multiple sclerosis, and Parkinson's disease. Beta amyloid protein deposits in the brain, a key marker of Alzheimer's disease, have also been found in the retina, where they may be detectable through AI analysis. Early recognition of diseases has the potential to pave the way for preventive strategies, enhancement of patient outcomes, and overall improvement in the quality of life.